Good evening, everyone. Welcome to the first session of the Global Surge Network, Surgery 101. I'm Akatya, a final year medical student and the founder and president of the Global Surge Network. I'm so delighted to welcome Dr. Rohan Khandelwal, sir, to officially start off with a series of interactive talk sessions. He's one of the most brilliant surgery professors in our country, and every student
to do surgery. And after that, it was just building on that passion, and that passion just grew with every passing year of MBBS.
Thank you, sir. Moving forward, could you highlight some of the specific practical skills which are required to become a successful surgeon?
Okay, so, well, you also asked a question, what is the day like for a surgeon? Well, for everyone, it's different, but there's certain common things for all surgeons. So firstly, a lot of people think that surgeons cut first and then think about it later. Well, that's not the case. So for me, the day starts, spending time with my daughter and then go off to the hospital. I am the kind of surgeon who likes to start early, and I like to do the first case of the day. So by 8:30, my patient is anesthetized and I start operating. Once I'm done with my surgery, then I have my OPDs, and then I come back home and again spend time with the family, read up on things, and my other passion is teaching, so spend some time on social media answering queries raised by various students. For all surgeons, I think so discipline is very important. So you need to be very disciplined as a surgeon because a person's life is in your hand. And, unlike medicine where you give a tablet or give something and hope for it to work, here you're actually controlling things. So discipline, I feel, is extremely important. And the surgeon, once you enter the theater, you need to leave out all your doubts, all the other things which are going on in your mind outside. So that's another very important skill for a surgeon. You need to zone out when you're in the theater and just focus on the task at hand. You should be willing to learn new things. So this is an evolving branch. You need to read and evolve as the branch is evolving. So those, I think, so would be the key attributes for somebody to become a good surgeon.
Thank you, sir. So, as a building cannot be made without a strong base, how can a medical student like all of us keep in mind to make their surgery basics very strong?
Well, my first advice to everyone is to read standard textbooks. Unfortunately, everyone is looking for a shortcut, and that really does not work out well. So read standard textbooks. They are very interesting. The way things are portrayed in them, it is a delight to read them. And something like Bailey, I can still read it multiple times, and every time I read it, I learn something new. We are going through tough times right now, and clinical postings are not being held. But when the clinical postings start, that is another request that all of you should attend your clinical postings. And the thing is that a lot of times I hear students making lame excuses, saying that, our seniors told us not to come to the clinics in second year or third year or fourth year. Well, that's just a very lame excuse. If you go to the clinics, you'll definitely pick up something. Then another excuse is that nobody is willing to teach us. You have to be after their life. You're the one who wants to learn. The person sitting there is already probably finished their post-graduation or senior residency. So you need to push them and, extract information out of them. Another advice to everyone is to maintain a logbook. And this is something which I did all throughout my undergraduate tenure, especially for surgery. I mean, I wasn't very regular with it in medicine or other branches, but surgery, whatever I used to see in the clinics, I used to come back and write down 2-3 lines about it, read the book regarding that topic and add few more points. And that those log books are still with me. So, sometimes I go through them and they're fond memories when you flip through the pages of those log books.
Thank you, sir. So moving on to the next question, can you touch up on the aspect of integrating surgery with other clinical subjects in the final year?
Right. So again, the basis of this, if you think that all the integration is going to happen in final year, you're mistaken. So if you have a strong base right from second year, then this integration becomes very easy. So if you're talking about surgery per se, then something like anatomy is extremely important. And the anatomy which you learn in first year is very volatile. So it has to be learned with a clinical bent of mind. So from second year onwards, when you start going to the clinics, you start reading the surgical anatomy and you see the practical aspects of anatomy in your surgery postings. Second is pathology. A book like Robbins is a Bible for surgeons as well. And I can tell you my Robbins was underlined at least 6 or 7 times, and the pages were, coming apart. I had to get it, stick it with tape. But I still remember the things I've underlined in my Robbins. I still can make out. My wife is a pathologist and she also teaches. And sometimes I can tell her that, this thing is written on the left side of Robbins in this column and in this table. So that is the kind of knowledge which you need to have regarding pathology. That's going to be helpful for you later on as well. So if you have a strong base of anatomy and pathology and medicine as you're going through the various years, then integration becomes very easy.
Thank you, sir. So what our approach towards surgery in the clinical years should be to clear NEET or next?
Look, if you're still in second, third, or fourth year, I would still strongly recommend reading standard textbooks for surgery. Now, I read a comment right now saying that when we read standard textbooks, we can't remember stuff. So, some of you watch my videos. There are other people who are teaching as well. So if you think that you are unable to understand from standard textbooks, you pay attention to what is being taught in your college. That is your first point of contact. And once you listen to the lecture, you come back and read the book. That's going to be helpful. Otherwise, you listen to my videos or some other faculty's videos and then read the book. It will become easier for you to comprehend what is written in the book and to retain those facts. But if you're a final year, pre-final year student, along with our videos, you should read standard textbooks because it helps in reinforcing concepts which we are teaching you via our videos. Again, clinical postings are a must. You need to have a book like an ESTAS, which is a clinically oriented book, and that would help you with your clinical methods.
Absolutely, sir. Thank you. Moving forward, so could you tell us about the importance and weightage of surgery as a subject in NEET PG versus USMLE?
It's like comparing apples with oranges. So, I wouldn't like to draw that comparison, but having cleared both the exams, I will just share my views regarding how surgery is asked in both the exams and how important is it. So in the NEET exam, it is one of the major topics. And as in the proposed next exam, it is going to be one of the 3 major topics from which 120 questions are going to be asked. Okay. So it forms a huge bulk of your MCQs. And of course, when you take into account integration with radiology, pathology, there are some additional questions also, which you can say come in the kitty of surgery, right? So extremely important for NEET. If I compare it in USMLE, in step 1, you don't have any surgery being asked in step 1. In step 2, CK, surgery is asked. But in step 2, CK, it is a medicine-oriented exam. So the surgery which is asked in CK is predominantly trauma-related surgery. and some bit of GI surgery, which is asked. So to answer your original question, if you want an answer to that, in NEET, it is very important. In USMLE, it is a distant second as compared to medicine.
Right, sir. So if you could, elaborate more on your journey through USMLE and how did you manage to get a fellowship and what are the steps we need to take to follow the same?
Okay. So why I like USMLE as a licensing exam and the whole structure which they have is that they judge you on the basis of a complete person rather than just a score on the exam, which is unfortunately the case in India, right? So if you are aiming for USMLE, your preparation should start from second year undergraduation. And by that, I don't mean that you need to read the notes or you need to solve MCQs from second year, but you need to start developing your resume from second year onwards. By that, I mean get involved in some research. You have the STS program, or if you have some research being done in your college, some interesting cases which are being written up by your professors, you can help out in that. So that would help in the building up of your resume. Strengthen your concepts, read standard books. Don't run after reading Kaplan notes or USMLE World, Q-Banks. Those can be done later on, right? I am again a strong believer that step one for Indian students should be taken during internship, because unlike the curriculum in America, our curriculum will focus on medicine and surgery in final year. So, and the questions which are asked in step one are also integrated questions. So the complete knowledge of those questions you'll only be able to gain once you've done your final year. Okay. During your internship, I strongly recommend that you go to America and do an externship or an observership. Externships are better. I took a 3-month extension from my internship and did 1 month of rotations each at Harvard, Hopkins, and Cornell. And they were really eye-opening experiences. Like in my rotation at Cornell, I was in a level 1 trauma center in Bronx. And we talk about Indian cities and the crimes in Indian cities, but one should witness that that was in the middle of Bronx. And each night I was on call, you could hear gunshots outside, and at least 2 to 3 gunshot victims per night call I used to see. So that was a tremendous experience, to how to deal with that kind of trauma, and the kind of patients they were able to save was something from which I learned a lot. And those were things which we implemented when I was doing my post-graduation here as well. So you, of course, learn a lot of things. In my Harvard rotation, I was in the bariatric surgery unit. And this I'm talking about 2006, so which is almost 15 years before, where the concept of bariatric surgery in India hardly existed. So, to see the entire bariatric program and to understand the implications of that surgery at that time was again an eye-opener. So that is something which I recommend for everyone, even if you're probably planning for Indian PG. There's no harm in going and spending a month or 2 there just to understand their process. And, a lot of people say that Indians are smarter or their knowledge is more. I completely agree, right? Indians are the smarter lot. Knowledge is also better, but those people are more organized. In terms of organization skills, we have a lot to learn from them. In surgery, their day starts for an extern like me, an intern, the day starts at 4 a.m. 4 a.m. was when I used to enter the hospital, take the rounds, and by 7:30, the first patient was induced, 7:30 a.m. By 4:35, everything was over and everyone used to go home and enjoy themselves. Right, so they had a good work-life balance, which is something which in India is a concept which is, which people don't understand. They think, no, if you're a doctor, you should be slogging in the hospital only. You should only come back late at night. and that work-life balance is not there. So that's something which you have to develop. Okay, their paperwork immaculate, and their documentation excellent. So those are things which we need to learn from them.
Right, sir. So, sir, to become a surgeon in the UK, which route is better? Is it the PLAB route or is it the MRCS?
So I took the MRCS route because I appeared for my MRCS exam, my step part A exam when I was first year postgraduate, and then the second part once I cleared my post-graduation. So that was the pathway which I took. That's an easier pathway for surgeons to get an entry-level position there, and gradually you can work your way up. Unfortunately, I'm not familiar with the PLAB route that much because I haven't appeared for that. But now, given the current circumstances in UK and after COVID, there are a lot of positions which are going to open up in the next few years. So either of the pathways are good enough to secure a position in UK for the next few years at least.
Right, sir. So if you could, tell us some pros and cons about MS versus DNB in surgery.
There was some bit of discrimination earlier, but there is a video on my YouTube channel where I've addressed this, that now there is not that much discrimination. Both are pretty much equally rated, and even DNB candidates are appearing for their super specialty exams. They're also clearing it, and they're also getting place in the premier institutions of the country. So I would say that there's no difference. Yes, people do say that clearing the DNB exam is a bit difficult as compared to the MS exam. The theory, yes, but I feel that if you study well for your theory, that that's a good thing for you when you're appearing for the MCH exams.
Right, sir. So moving forward, so if you could give us some overview about the life of a neurosurgeon and opportunities in the field of neurosurgery.
Look, all fields in surgery, there are a lot of opportunities which are there. And so is the case for neurosurgery as well. Branches like neurosurgery and CTVS, cardiothoracic surgery, these are branches where you need to work in a team for a long period of time before you can establish yourself independently. If you compare it with a plastic surgery, or if you compare it with pediatric surgery or GI surgery, these are places where you can establish yourself independently much earlier. But in neuro and CTVS, you need to work under someone for a longer period of time. It is a stressful branch, and it can sometimes be depressing as well, given the mortality in some of the sub areas of neurosurgery. But in terms of scope, there's tremendous scope in our country for neurosurgery.
Right, sir. So many female medical students wanted to know that how is surgery as a career option for women? Are there any challenges that, people say that it's not a good option for, female medical students? What do you have to say about that?
Well, I have strong views regarding this, and I have posted on my YouTube channel regarding this as well. I feel it's an excellent branch for females. And, because I've been teaching students for the last 12 years, a lot of time when the counseling comes up, a lot of female medicos approach me and they ask me whether we should take up surgery or not. And, their statement is that I want to take up surgery, but my family is not agreeing. Or I have got such a rank where I can get radiology and dermatology also, but my heart is in surgery. I want to take up surgery. What should I do? So, you should always follow your heart. That is what I feel, that if you want to take up surgery, you take up surgery. Okay. And like I told you, work-life balance and all these things are something which you have to work towards. So I know female surgeons who are doing extremely well in their professional career. They have families as well. They take care of, they spend time with their families as well. And they pursue their hobbies also. So it is very much doable. yes, this is a physically demanding field. So the initial years are difficult, but it's not something which a female cannot do. So I would strongly recommend, if somebody is interested, they should go for it.
Absolutely, sir. Moving forward, is it better to learn and practice oncosurgery in India or outside India?
There's tremendous scope everywhere in oncosurgery. The incidence of cancer is going up, and there's huge scope wherever you want to practice.
Right, sir. So one of the students had a very impactful question for you, which is, sir, how does a surgeon bear the mental brunt of seeing their patient die either on their OT table or post-operation due to various reasons, especially if they knew that the patient personally or they realized that they could have changed the outcome and dealt with the problem with a different post-op, while also taking the patient's family members into consideration?
Well, there are multiple variables in the question which you've asked, I think. So, you start encountering death as a medical student only. And I still remember the second day of our medicine posting. There was a cubicle where there were 16 beds plus Safdarjung. If there were 16 beds, there were 16 people lying on the floor as well. So total 32 patients in that cubicle. And second day of our medicine posting in second year MBBS. And in a span of 3 hours, we saw 4 deaths there. Okay. So that was an eye-opener for all of us. But, that day I was standing there and somebody was teaching us. And a part of me thought that, why is this person still teaching us? Why can't he leave us for some time and take care of these patients who are dying? There were other doctors who were taking care of them, but we always thought that, why isn't the senior attending to them? But gradually you learn that it's part and parcel of your training, and there are certain patients for whom you can't do much, right? So they're on palliative care, and all you can do is make sure that they don't suffer, they don't have pain. So that is one aspect. The other aspect which you said was that if you know someone, of course, it is difficult. It takes a longer time for you to recover from that trauma. And the third one is when you know you could have changed something and saved the patient. Well, I think so. There will be certain situations in your career as a surgeon where you will encounter such patients, and you will, look back and think that probably one decision would have been better than the other decision. But that's again part of the learning process. That's how you learn, and you will not make that mistake in future. At this time comes the support of your friends and family, and you need to divert your mind and gradually come out of that trauma and start operating again. This one-off thing cannot be something because of which you stop operating. Of course, counseling is also available. I mean, and there's no harm in taking counseling. There shouldn't be any embarrassment if you reach out to a friend who can help you with counseling also.
Right, sir. Thank you. So, was there anything you would want to go a few years back, or change something, or take up, if you could choose another specialization or do something differently? Would you ever do that?
No, I'm very happy with what I'm doing. Actually, when I started pursuing my career in breast cancer surgery, there were hardly 20 odd surgeons all across the country who were doing dedicated breast work, not even 20. So now the number is growing exponentially, and there are at least 100 of us now in India who are doing dedicated breast work. So, for me, the inspiration came from a friend of mine whose mother and the mother's real sister both died because of breast cancer. Also, certain family members who've suffered from this disease. And my mentor in medical college was an eminent breast surgeon. So these were my inspirations to take up this branch. I wouldn't choose any other branch. and I'm very happy doing this. This is something which, and somebody used to tell me when I wanted to do breast surgery, that won't you get bored of doing just 3, 4, 5 procedures? Well, first of all, I don't get bored. I think so. The more you do one procedure, the better you get at it, right? So it's better to do 5 procedures in a good manner rather than 20 procedures in a not so good manner. That's number one. And that's the same way as saying that Usain Bolt runs so fast. Why does he just run 100 and 200 meters? Why doesn't he run 400, 800 and 1500 as well? So I feel that if you can restrict yourself to a few surgeries and master them, that is the need of the hour, at least in tier 1 cities where people are looking for super specialists.
Absolutely, sir. Thank you. So over the years, you have performed innumerable successful surgeries. Is there any memorable case or operation or a challenging experience which you would like to share with us?
There are many, I think so. There are memorable cases in each sphere of your career. So as a postgraduate, I have shared one of the cases in Marrow as well. This was a patient where there was a gunshot injury where the gun was kept close to the iliac bone and fired. So it shattered the iliac bone, went into the abdomen. There were 3 perforations there. And I was a second-year postgraduate, just entered second year. And that was the case where I got to do my first resection and anastomosis. So, I mean, that's a case which I'll always remember. And, collecting those pellets, we had collected 56 pellets. And even after that, there were at least 60 odd still scattered elsewhere in the abdomen. So I still have that X-ray with me. So that is a case which I still remember from my post-graduation. Senior residency, another case which you must have seen on YouTube is what I call Metalloman. This boy had a psychiatric disorder of eating metallic objects. And he used to eat his sister's hair clips, Diwali lights, bulbs, batteries, everything. And he'd also ingested 2 high-powered magnets. So all the things were stuck to these magnets and were all lodged in the ileum. And he was asymptomatic. Unfortunately, when he got caught and when he gave up eating these metallic objects, that's when one of them perforated the intestine. And when he came to us, I was the senior resident on call that day. We had resected 3 feet of ileum and almost 300 metallic objects we'd recovered from there. So that is a case which I remember from my senior residency. Again, then 15 days before I left my senior residency to pursue my first fellowship was when the Nirbhaya case happened. And it was our unit who was taking care of her at Safdarjung. And that's a sight which I'll never forget. I mean, a ghastly sight. Sometimes I still get, I still have vivid memories about that. And I just hope nobody has to suffer the way that girl did. Then, of course, you have patients in your practice, and every day is a memorable day when a breast cancer patient finishes her treatment. And, when you see them and follow up living a normal life, that's a celebration in itself.
Thank you, sir. So the next question is that how can we get electives in universities like you said, Cornell or Harvard?
Right. So things have changed ever since the time I applied and what is the current status right now. Now they require you to clear step 1. So a lot of them want your step 1 score. They'll want a letter of recommendation from your parent institution, a statement of intent from your side. These are the bare minimum requirements. Some of them want an IELTS score as well. And you need to apply at least 6 months in advance because there's a lot of rush for these electives these days.
Thank you, sir. Moving to the next question. As due to the pandemic, our clinical postings have been hit. How would you suggest that we study surgery without the presence of any clinical teaching?
So it's very difficult, and this is something which everyone is evolving their own methods to cope up with this situation. What I would recommend is that all colleges are holding online classes. So listen to those classes. If you have videos of either my videos or somebody else's videos, listen to them. Read the standard textbooks along with that. And there are a lot of places on YouTube where you can find clinical cases. There are some on my YouTube channel. There are some in the Marrow videos which I've recorded. So you can listen to those clinical cases, and that would be a starting point. And whenever things open up, do try to examine patients. So that would be the only, that's the biggest drawback right now, that you can't examine, you can't touch patients. So that is something which you'll need to, overcome as soon as clinics open up, or if you're entering internship, make sure you spend extra time to cover up this deficit of clinical examination.
Thank you, sir. Considering the current situation, what surgical advancements are required in the management of COVID patients?
Well, surgery for COVID patients, I think so. If you have an emergency surgery, you need to operate the patient irrespective of their status, and you need to take adequate precautions yourself. Patients who are suffering from COVID and undergoing surgery, those who are undergoing anesthesia, there is a chance of a flare-up of their COVID. So you need to involve a multidisciplinary team who can take care of these COVID patients. But I feel that your safety is of paramount importance when you're operating a positive patient. If it's an elective case, we all are doing routine COVID tests before operating elective cases, and only operate a patient if they're negative. Reduce the amount of time they're in the hospital. So most of my surgeries are a single day admission or daycare surgeries. But ever since COVID, I'm doing a lot of daycare cancer surgeries as well. Those who would have usually stayed for one day, now I'm discharging them that same day as well.
Right, sir. Thank you. Moving on to the next question. What is the right time for medical students to decide what specialty they want to get into?
So it varies. I mean, for some, like I told you, I was very clear in second year of my undergraduation. But I would say the bulk of students make up their mind when they enter internship and they're exposed to all the branches. That's when most of them are able to make up their mind which specialty they want to choose.
Thank you, sir. So what are your thoughts on alternative medicine?
Look, I am not against alternate medicine. In fact, my grandfather used to practice a lot of naturopathy at home as well. But what I feel is, and this was, there's a course in integrative medicine at Hopkins as well. And I happened to meet the course director when I was there. So the key takeaway is that not all branches can treat everything. And as long as you know the limitation of your branch, then you're doing fine. Like, for example, it really hurts. I feel so sad when I see cancer patients who've been given false hope by alternate medicine doctors. And when they come to me with metastatic disease, when initially they are presented to them with stage 1 disease, that's what hurts me the most. For something like a sinus problem or something like warts, something like skin, some of the skin issues, homeopathy or Ayurveda does wonders. And I've used it for my own sinus problem. But I know that those are things where it'll work. I will not go to a person if I have a tumor. I'm not going to go to an alternate medicine doctor. And I guess that is the level of understanding which we want from the alternate medicine colleagues, that they should know the limitations of their branches as well, and not just blindly claim that they can cure everything.
Right, sir. So one of the students wanted to know that if they haven't, applying for USMLE, can they still do observerships in those colleges?
Yeah, even if you're not applying for USMLE, you can still go for observerships. There's no problem.
Thank you, sir. So the next question is, what are the future opportunities and options available if I proceed with general surgery as my PG?
So look, a lot of people think. In fact, there was a very interesting post which I saw in the morning in one of the surgery groups, that has MS become just a branch or a bridge course for MCH? Well, that's not the case. There is still a role of a general surgeon, not only in tier 2, tier 3 cities, but even in tier 1 cities. Even in a place like Gurgaon and Delhi, I know so many people who are just MS general surgery, but they have roaring practices, right? So even if you've just done a general surgery, and if you can enhance your skill set by doing laparoscopic surgery, by learning a few other procedures, you can still do very well.
Thank you, sir. The next question is that if a student, is aiming to give MRCS, when can he or she start to prepare for it in terms of studying surgery?
So MRCS, I would strongly recommend if you're doing a post-graduation, that's when you start studying and appear for the exams during your post-graduation. If you're taking the PLAB route to go to UK, then you can do it even without your post-graduation, but you need somebody to certify 2 years of training for you.
Right, sir. So the next question is that when is the right time to apply for these observerships?
So observerships, I applied for them during my internship, towards the end of my internship. And you can probably apply for them if you have a gap between the time when your final exams get over and your internship starts. That's one window which you have. Another window which you have is, supposing you've cleared an entrance exam and you're about to join in India, you're not appearing for USMLE, then that's another window when you can go. But for those who are applying for USMLE, you should try to do externships. Externships are ones where you're actually allowed to talk to patients, you're allowed to examine patients, and the best time to do that is to take an extension from your internship and to do this for 2 or 3 months.
Thank you, sir. So the next question is that why do you think is surgery so underrated in India, and how can we change that?
I don't think so. Surgery is underrated in India. Those who want to take up surgery are taking up surgery and they're doing well. I don't see surgery seats going vacant. So I don't think surgery is underrated.
Absolutely, sir. So how to cope up with situations where you feel like you've made a wrong decision opting surgery as a career?
I have made a wrong decision, or somebody else has made a wrong decision?
But if somebody else makes a certain wrong decision?
Well, I mean, if they've taken up surgery and they're not liking it, then either stick to it and maybe you start liking it in future, or you leave it and start preparing for the entrance exams again.
Right, sir. Thank you. Coming to the last question. So, your message to all the students here?
Well, my message is very simple. Become good doctors, become doctors who can connect with patients. And being in private practice, I've realized that a major problem for a lot of litigations and a lot of unhappiness against doctors is the lack of connect between the doctor and the patient. So listen to the patient's problems, try to address those problems, have sound clinical knowledge. I know entrance exams are important, but it is equally important to develop a good clinical skill set. I always remember, my parents are also doctors, and they always told me that, work so hard in your internship and in each and every posting. And the reason for that is because this is the last time in your career that you'll actually be working in majority of the clinical branches. Then you'll just be stuck to one branch. So learn the basic tricks of trade for all the branches, so that if ever you encounter a patient, you know what to do. So don't skip your internship. work hard during your internship, go to the clinics. Even if your seniors tell you don't come to the clinics, don't listen to them. Go to the clinics. And even if you go to the clinics and just talk to the patients, just see what is happening, you'll end up learning a lot of things. Right. That's my message.
Thank you so much, sir, for your valuable time and guiding us through this amazing session. I'm sure all of our attendees have a lot to take home, and they are more excited to pursue a career in surgery now.
Thank you very much for having me over. Thank you.
Thank you so much.
Thanks, everyone. Take care. Bye.
Thank you, sir. We would like to end the session here. Thank you, everyone, for attending. Thank you.
Thank you, sir.
Thank you. Thank you.
Thank you, sir.